One of the questions that I've been asked over and over and over again is why I'm so insistent that people see a pediatric pregnancy specialist when they're pregnant and then have their babies adjusted on a regular basis. Specialists in pediatric and pregnancy chiropractic have hundreds of hours of education in this, and this is a very big, very important piece of what we do. There's specialized equipment, there's specialized adjusting techniques that are critical to proper function and obviously pain relief for the mom. When you get pregnant, you release a hormone called relaxin. It does exactly what it sounds like. It makes all the joints kind of just relax and go loosey-goosey. This is important because when you're trying to have a baby, the pelvis has to literally separate for baby to pass through it. So it has to, the tendons and ligaments have to loosen up. Well, the problem with this is that those hormones don't just hit the pelvis, they hit everywhere. The neck, the low back, the knees, everything. And so you have to have somebody who knows how to properly reset all of those things while you're pregnant. And so that's a very big piece. Now, outside of mom, a lot of us have woken up after you've slept in a hotel bed or even your own bed. You woke up and you go, oh, I slept for 6 hours and I have this terrible kink in my neck because I was sleeping slightly like this for 6 hours. Imagine that baby that's been all crumpled up in the womb for, 9 months. Imagine how kinked up they are. And if all of the nerves that come from the brain go down the spinal cord and come out that run all the organs, if those get pressure on them, they're going to have major issues. So we look at colic, torticollis. We're talking about digestive function, gas, latching issues. You talk about all of those things, and there's, my son, when he was born, had this massive cranial ridge because it was my firstborn, and the skull, he has a big head, and the plates got pushed together. Well, it was important to me that once he lost his hair, he had a nice round head. And so the pediatric chiropractor I used in my office, I had her reshape his head so now it's completely round. She could have gotten the helmet route, but that substantially reduces actual function of the cranial bones. And when they breathe, they're supposed to move, and they couldn't move with a helmet. So I wanted this done in a more physiologically friendly way. And so Kelly was able to reshape them, and now his head is perfectly round and everything's great. So that flat head that a lot of babies get, pediatric chiropractors can fix that. There's a lot of other little things that they can help with and they can knock out. Colic was always my favorite because you bring in this brand new baby and that's crying, it's been crying for 2 or 3 days, and you don't know what to do, and your pediatrician told you, well, sorry, colic's terrible, and there's just nothing really you can do about it because there's no really drugs you can give for it. What colic is a little spasm of a tube, and the tube is the intestine, and it just causes lots of gas and bloating and pain like that. You can reset the spine so that the nerve that goes to that muscle will calm the muscle down, and then you can massage out that area. And I used to love to do this. I don't do it anymore because I let my pediatric chiro do it. But because they give this brand new baby to this big, huge guy, and the parents are, totally disheveled, exhausted because they haven't slept in 3 or 4 days, terrified because it's the most precious thing in their whole world. And they're talking about, well, no, we keep being told that no, there's nothing you can do, and we're just so exhausted, and we're so worried about the baby because it's obviously in pain. And while they go through this big litany of everything, I adjust the baby, and it takes, a minute, 2, 3 minutes. And I hand the baby back to them, and they go, okay, and we start walking to the front, the baby falls asleep. And which is very normal for a lot of these colic patients because these kiddos they usually sleep 60% of the day, and they've been awake for 2 straight days. They're going to pass out as soon as they're not in pain. And it's so much fun to watch these parents just, as you take this baby out of that. So there's a lot of things like that that are extremely important to do. Ear infections is a big one that we see chiropractically just knocking out really easily. They don't need the antibiotics most of the time. You can knock that one out. Kelly's favorite is bedwetting. We've had kids who are 8, 9, 10 years old who their doctors are putting them on these really powerful drugs, and the issue is that their sacrum's torqued from birth, and so the pressure's on the nerve interfering with communication between the bladder and the brain. The bladder just doesn't tell the brain, hey, we're full, and at night it releases on its own. So you reset the sacrum, and that communication pathway opens back up, and they're fine. So there's a lot of reasons why you need to get your kiddo in to get them adjusted. When my wife got pregnant, I found a pediatric chiropractor and brought her into my practice to work on my family. I knew that while I was really one of the best at sports and I was one of the best at nutrition, that I wasn't the master of pediatrics, and so I brought someone in to take care of my family. So that's kind of my personal, endorsement of, not all chiropractors can do what pediatric chiropractors can do. So find someone who specializes in pediatrics for your pregnant wife or your pregnant self and for your children, especially those brand new babies. My pediatric chiro actually came to the hospital and adjusted my kids when they were an hour and a half old. So if you're wondering when's too early, there isn't a time. So as soon as baby comes out, get them adjusted. So highly recommend that you find somebody specific in that and get your kiddos taken care of.